We live in a world defined by speed and connectivity. Data moves across the globe in milliseconds, and digital innovation scales faster than at any point in human history. Yet, when we try to apply these exact same technologies to improve the actual health of populations, that potential remains shockingly untapped. For years, global health development operated on a massive assumption. Tech developers assumed that if they built a sophisticated new tool, doctors and patients would simply adopt it. Imagine designing a cutting-edge diagnostic app. It might be brilliant software, but without basic digital infrastructure, the system rejects it entirely. This top-down approach also fails because it ignores local medical needs. The tool breaks apart before it ever reaches a patient. The result of this mismatch is millions of people isolated from the care they desperately need, while high-tech solutions sit idle. Technology alone isn't a magic bullet. Without rewiring how we deploy tools, careless innovation widens the digital divide. To fix this, the World Health Organization adopted a roadmap called the Global Strategy on Digital Health. It is a complete structural reversal of the old development model, pivoting entirely away from gadget pushing. Instead of starting with a product, the strategy starts with a systematic assessment. It identifies exactly what a specific country needs before a single line of code is written or a digital solution is introduced. Developers are no longer guessing what might work. Now, the supply of innovations is proactively matched to verified, on-the-ground medical demand. In practice, assessing local demand looks like this. It means understanding the reality of rural clinics, how healthcare workers manually record patient data, and what physical constraints they face every day. New technology has to integrate into this baseline reality to be useful. The global strategy classifies digital health as essential public infrastructure. Success ultimately depends on engineering these systems to function within the specific constraints of the environments they serve. The foundation of this engineering is interoperability. This is the critical technical standard that forces isolated, incompatible digital systems to speak the exact same language and share data seamlessly. The WHO implements this through initiatives like the Open Health Stack and the Global Digital Health Certification Network. These programs standardize the framework, turning chaotic data silos into a solid, continuous pathway. For a patient, the benefit is immediate. Their health record travels with them effortlessly, drastically lowering the friction and barriers to receiving care. These networks also support the people delivering that care. By integrating simple tools and digital payments for healthcare workers, local clinics are seeing massive boosts in their staff retention, daily motivation, and overall impact on the ground. On a macro level, this connectivity fuels global scientific communities of practice. Clinical experts worldwide can now collaborate and share medical knowledge instantaneously, effectively eliminating physical borders. Because this is a new frontier, regulation is absolutely necessary. The WHO actively evaluates emerging tools, like artificial intelligence and digital health wallets, to ensure they lead to evidence-informed policy and guarantee patient safety. By enforcing open standards and prioritizing safe innovation, the WHO is taking a highly fragmented landscape of isolated gadgets and transforming it into a cohesive, life-saving global nervous system. We are now moving out of the era of isolated tech experiments. Global digital health is permanently transitioning into a sustainable, universal infrastructure. Today, member states, regardless of their current income level or existing access to tech, are using these tailored digital strategies to build highly resilient health systems. This digital resilience has a direct impact on the physical world. Smart data networks coordinate the complex logistics of moving physical medical resources, ensuring that equipment and treatments arrive exactly where they are needed most. Medical access in the modern era requires a broader definition. Providing quality care today means building both the physical clinics and the smart, equitable digital networks that link them to global resources. Achieving universal health coverage in the 21st century relies on the systematic, intelligent networking of tools we already have. This unified approach ensures quality, affordable care reaches everyone, everywhere.